25 years of age, one of the first American therapists in the country. So we want to welcome you, watch them on television. We have one or two projects we want to showcase. What was written against our name is the Benin project, the rehabilitation of the teachers class, funded by the federal government. In addition to that, we also have the stem cell transplant, which is a trailblazer. I'm sure you are aware. This will just be the third in Africa. There's the first in West Africa, only after Egypt and South Africa. So we'll go to the location. The other project we want to show to you because of time constraint is the radiotherapy. That is the unit that is used in treating cancer patients. These are major interventions in the hospital.
Maybe because of the...
So Michael, if I didn't see the University of Unity Hospital, very primitive cells that are transferred from one person to the other. But for somebody to receive tissue from one person to the other, it means you have to knock off that recipient's immunity, kill the immunity completely. Otherwise, he will reject any other substance from another person. But to bring the matter to a common understanding, you can, in this unit, change the genotype of a child or an individual from sickle cell to AA. Yes, it's been done. So that is the closest we can go. Otherwise, it's a very technical issue. You bring in very primitive cell from a donor, and you give that primitive cell to a recipient. That recipient, for him to receive the primitive cell, you would have reduced the immunity in that recipient to the barest minimum so that he can accept what you are giving to him. That is why it's called stem cell. The transplantation that you are transferring from one person to the other. But it can also be used for cancer patients and others. But the main beneficiaries will be individuals who have sickle cell anemia, who will change their genotype. Once it is changed, they are no longer sickle. So that is the problem. The place is virtually airtight, the areas that we are going to, and it's sterile. So you may be requested to change or wear something on top of what you are wearing now. And the equipment are out there.
Fine. All right. So only those.
Two more.
Where is Minister of Works?
He said he doesn't want to address.
Your cap.
So we're actually supposed to go into this room and change, but we've just done that now. So we'll take you straight to the walls.
We have headgear.
When you get
Pick this one now.
You can't wait again.
You can't wait.
No, it's okay.
Give this to okay. Okay. So let's see. Okay, so these are fridge. Usually we keep our blood products. We refrigerate them at because they are actually irradiated. They are not the usual blood that we give to the normal patient. We ensure that this blood is irradiated to ensure that no organism is left within the blood products. And here. Contamination of even our IV fluids and the blood products that we manipulate in that place. Then because the unit is also special, we don't get food from the general kitchen. The food that is given to the patient, especially during the period of aplasia when your marrow is being destroyed, is special. They don't take vegetables, they don't take partially cooked food, they don't take drink. This is a kitchen, so they pass their food through this place during the period to ensure that they are not infected. Also, we don't send our gowns to the general laundry. We must ensure to prevent contamination. So this is where we have our laundry. The clothes are sterile from here, and then we start using them. Here's the corridor. It has, but we're hoping that when the others are furnished, we could take more than one at a particular time. The room is airtight, and the essence is to prevent, organisms from affecting the patient, especially aerosols. This is to prevent, because at this particular time when we have destroyed the bone marrow, the patient is prone to infection. No one single cell to protect the patient. The patient is kept here, but the donor is harvested in the theater. We have a special theater meant for bone marrow harvest on a day when no other surgeon is operating. So the room is fumigated, the theater is prepared. We harvest the marrow cells, just like blood, put it in a special bag, transport it to this. By ideal, we should have a complex that have a theater within. So you don't need to move at a distance. So, but we have to move it to ice pack to this place, transfuse the patient here, and then when the patient starts taking in the cells, begin to prepare the patient. And every room has an inverter battery attached to the plasma, because once the patient is on, we don't want a second of light going off. So in between,
come this way, you are blocking on that.
So in between,
come this way, you go to that. Come here.
What's the light here 24 hours? So this is an average stem cell transplant isolation room. We're also supposed to have full gear of monitoring apparatus. There's an oxygen tank that comes from here. So everything has to be airtight and sterile. Before you come in, you have to sterilize your hands. So it's a very high-tech medical approach. Yes. So we are supposed to replicate this room, in such a way that we can take in more than one patient. Because if we are taking one patient at a time, we are running the generator for 100 days, the cost implication, and the drug we use, once it's opened, you discard. But if we have about 4 patients or 5 at the same time, then the cost will drastically come down. So these are the issues. So that's a summary of what we have here.
So how many people have you trained experts?
We have 2 hematologists. I went for a year, but the others have just gone for 3 months. The second one went for 3 months. Nurses, we trained 2. 2 was trained with me. 2 was also trained recently. So we have 4 nurses. The lab scientists, we have 2 lab scientists trained. But we have an arrangement with our foreign counterparts for 5 years to continuously train 1 doctor, 2 nurses, and a lab scientist.
In Holland?
In Switzerland.
In Switzerland,
yes.
Switzerland.
So that's the whole.
Is it the only center in Nigeria?
Yes, in West Africa, apart from South Africa and Egypt, we're the only center that is doing transplant in Africa. So we're hoping to be able to have an international center where we can pioneer, especially for sickle cell. In other places of the world, they don't have much patients with sickle cell, but we have over 3% of Nigerians have sickle cell disease. And that's a huge number that we could, But the procedure, as CMD said, can also be used for blood cancers and any other cancer that we know. Blood leukemias, lymphomas, even some bone marrow failures, and so many other conditions. The essence is that if you even want to treat breast cancer now, the modern therapy, if you have a distant metastasis, you just go ahead, harvest the marrow of the patient, destroy the breast cancer with all the normal cells in the body, and then you transfer, because they always die from the damage to the bone marrow when you give them radiotherapy and chemotherapy. So the essence of bone marrow transplantation, you take this bone marrow cells out first, destroy everything, including the breast cancer cells, and then you transfuse back the cells.
So the potentials are great.
It's endless. We have never started the research. The research has to do with things like dementia, Alzheimer's disease, spinal cord injury, where we manipulate stem cells to form new bone cells and skin cells to cover up. Or when you have
potentials like this.
So much.
When did you establish this place?
We actually did our first transplant in September 2011.
Okay.
So we've been on it now for almost 3 years.
Yes.
Yeah.
Because he was away the first team were away for 1 year.
I think this is good. Groundbreaking.
Yes.
This is groundbreaking.
We'll see video other places go before the
Go back to
This block?
No, this one we're going. Which one is this? This is radiotherapy. The machine for.
And we've commenced treatment. It is part of the federal government rehabilitation effort in the various teaching hospitals. Incidentally, UBTH is in the second phase. The federal government intervention was meant to upgrade facilities across the hospitals in Nigeria, particularly teaching hospitals. And each hospital got a range of 2.1 to 2.6 billion to upgrade facilities. And they came by way of equipment. This is just one of them. With this equipment, you can virtually treat all forms of cancer, except those that are concealed in hidden areas, like the cancer of the cervix and the areas. But for that, there's a building across the road that we are putting up that will address that. When that is ready, we'll now have a comprehensive package for the management of cancer. The radiotherapist in charge is Dr. Adeyemi. So he will take us through the first part of the exercise.
Yeah. Let them go there. Good morning.
We captured the image on the screen outside of that console. So through that image, we were able to eliminate without input it into the computer, so that the computer will now send the message to the treatment machine, which is LINA. So the LINA, because in clinical marking, we just use an idea of clinical knowledge to know the area of the tumors. And one of the good things about this one is that not only that, because when we are treating, some of the energy or the dose will go to normal tissues, and that's because collateral damage. But with the treatment system planning that we have here, we will be able to know the dose that will go to different organs. If it's a toxic dose, if it's a high dose, we'll be able to see it on computer. So we can now make an adjustment to make sure that all the vital organs or the surrounding structures are within the normal tolerant dose. So that's the advantage of using treatment planning system. And that is what we have on the console. So after doing that, when we are satisfied with the dose to the tumor, the dose to the normal structures and the organs, then we now send the input to the LINA machine for treatment.
So what the next is machine? What simply what
Computed tomography. It's a computed tomography because the name is
For us, it has two generators the storage. And so those machines and it's not connected to that. So at 24/7, the generators are working.
you have inverters.
The inverters cannot back up. The energy demand is so heavy. So heavy. So we'll go to the main machine now.
This is not a language.
It's a lead, no patience. Yeah. This is a lead sheet.
Are we going now?
We can come.
Speak louder.
So this is the LINA machine. This linear accelerator. Linear accelerator. That's based on the linear accelerator. That's the name because it's accelerate electrons linearly. That means along the straight line. So this is the machine. It emits both what we call photon. Photon means high energy X-ray. And it's that high energy X-ray that knocks off the cancer cells. They can also generate electrons. Electron has a lower energy. And we use that one when we want to treat tumors that are not deep, because the electron cannot penetrate deeply. So when we want to treat tumor that is on the surface of the skin, we can configure the machine to generate electrons. And when we want to treat tumor that is deep, we configure the machine to generate photons, because that one can penetrate deep to photons. It just means radiation.
Does it open up there?
No, this is just to, when we manipulate this source into various angulations depending on the field and the target organ. We have to maneuver at different angles. So this is what we use to know the degree of rotation of the machine as it moves. It can move on its own without turning the chest. So that's the advantage of this. The patient stays in a stable position where we can move the machines in 360 degrees as we want. So,
any questions?
The point I want to ask, we have all these machines, and you are trying to do that.
Breast cancer, your cancers that we have, the patient is not really this machine.
What is
They are aware that such a machine is available. With this one, they don't have to travel far. They don't have to go to Lagos, Abuja, or go abroad.
at least 60 patients in a day.
How many?
It can treat 60 patients in a day, this machine.
60 in a day.
Then, so in addition to the question the madam asked, the management of this hospital has constituted a cancer management board. And one of the mandates of the board is to sensitize the public and to create a screening program for the cancer patients. So just to, in addition to the questions we asked.
That's right. Good. What's the name? Gabriel. Gabriel, jump. Great. Very well. It's okay. Everybody wants to see you.
It makes you a little bit.
The one you are calling a stimulator. Then we have two other ones in the hospital. The oldest one we have in the hospital has spent 15 years and is still functional. Still functional. But that everything depends on maintenance. But we have an arrangement with the supplier of the machine. They will be here with us for 5 years, during which they are supposed to train Nigerians to maintain the machine. But they are high-tech machines. So with time, there's even plan to upgrade it right now. Then the issue of collaboration with Sickle Cell Society of Nigeria. The stem cell, we have only used sickle cell as an example. It is not directed specifically at sickle cell patients only. Even patients from here will benefit. If you subject a patient to that treatment, by the time the patient comes out, the immunity is also low and he could die. So, but he can benefit from here. So, the coordinator, Dr. Bazai, is a leader in the Hematology Association of Nigeria. So that is where they handle issues regarding sickle cell anemia. The principle is that the younger the person, the higher the chance of uptake. But I think 15 years is the cutoff. Below 15 years, they are likely to do very well. But above 15 years, it will be difficult. That does not mean that you cannot do it, use the same procedure for individuals who have other conditions other than sickle cell anemia. Well, incidentally, it's not University of Benin Teaching Hospital. It's the information that the press conference I was given by a staff of University of Benin and not the teaching hospital. And the person is not a medical doctor. He's not responsible to us, so I cannot answer that question. There is no Nigerian medicine, US medicine, Indian medicine. We read the same books, we do the same practice. I mentioned that we're in collaboration with the center in Basel. So it is the same success rate they have there that we have here. There is no difference, as long as you meet the minimum requirement. And this center is now linked with other international centers. And they must ensure that the minimum requirements are met and the minimum conditions are put there before the patients are exposed. Thank you for that question. We can actually do so many. We can batch them. It will be more profit. It will be more cost effective and cheaper if we batch the patient, take 5, 10 patients at the same time. Because it's the same effort that you require to transfuse one or transplant one that you require to transplant 10. The reason why we have not been able to cascade it up is paucity of funds. The machines are available. We just need to be empowered to go to place order for the machines so that the other 4 theaters or the other 4 units. For an average room there, if you want to equip the other 3 rooms, it will require close to 24 million. Yes. No, the 3 put together. Yes. Issue of waiting time. Of course, one of the areas the ministry is working on is across board that the waiting time should be reduced markedly to the benefit of the patient, whether it's accessing laboratory services, theater, or facilities like this. The only way we can reduce the waiting time is to improve on our attitude to work and increase the number of facilities that are providing such services. For the LINAC specifically, of course, there are other co-founders, issue of funds and the rest. We are hoping that the treatment for cancer will be incorporated into the NHIs. Right now, it's not there. This will be a major policy thrust of government. Then the issue of individuals and the community not being aware of what we are doing. Of course, there are rules governing advertisement and the rest. But of recent, it's becoming clearer that a facility that like this can actually go on air and say this is what it can do, as long as we are not advertising individuals. Exactly. So what we are trying to do is to collaborate with the media people. But of course, we also have a constraint there. Each time you want to float a head talk, issues that will be beneficial to the general public, they ask you for funds. We are not empowered in that regard. If they will be willing to collaborate with us, as many of us as possible, we'll talk to them. I have about 174 consultants in this hospital, experts. Adeyemi has been away repeatedly to India, South Africa. Bazaye has been away. All of us have had to travel here and there for one form of training or the other. Of the 174 consultants that I have, as many of them as 50 are professors in their respective areas.
If you have something to say of the strike, the giant strike at the University of Benin Teaching Hospital. You've seen for yourself. So my admonition for Nigerians is that Nigerians should not just be rushing out of the country for medical attention, particularly in areas where we have local competencies. Like we talk about stem cell transplantation, the radiology department and all that will see state-of-the-art CT scan and the other machine, the diagnostic machine and the linear machine and all that. These are possibilities in our country. And this is a good development because not many Nigerians know that we have things like this in this part of the world. And I also know that this UBT here, University of Benin Teaching Hospital, is also a center of excellence for road accidents. Maybe the CMD for trauma, maybe the CMD didn't mention that, but that is also a very novel thing. Even all through the Niger Delta, the oil companies are taking advantage of that. There's a helipad in that center, in the trauma center, and they lift most accident victims and trauma victims, trauma patients to that particular place. So this is truly a center of excellence, and I want Nigerians to make use of this facility. Not just people in Edo State, but indeed people all over Nigeria. This should be a first place of call before thinking of traveling out. Thank you.
This is one of the hospitals in the second phase of the VAMED project. In the first phase, we had 8 hospitals. Maiduguri, Zaria, UCH, Jos, Lagos, there were 8, This is one of the second phase. In the second phase, this is one of the 6 in the second phase. So already, what you are seeing here is being replicated in 14 other centers, teaching hospitals. And the plan of the ministry is to actually extend it to the federal medical centers. As you know, the policy of the government is to have a tertiary hospital in each state. So realize that where there is no teaching hospital, you have a federal medical center. And that is the thrust of this current administration. Also, concerning the long waiting time, we are seriously working on that because we had the rollout plan, GOPD rollout plan, whereby patients are given appointments. So you go there at the time for the time you are given. And if for any reason a patient is dissatisfied, we have Servicom desk in every of our hospitals. You have the right to go to the Servicom desk, lodge a complaint there, and see what will happen within the next couple of hours. It is there, go there, try it, and
There are contact numbers for you there. I'm Dr. Kolajo, Federal Minister of Health.
Distinguished ladies and gentlemen, first of all, let me appreciate the University of Benin Teaching Hospital for the new grounds you are breaking here in highly competitive diagnosis and treatment of diseases that we used to think could only be treated abroad, particularly the stem cell transplant. The stem cell transplant is a highly scientific, technical process, professional process, which is also not old in the world. Understand now that your university is the first in West Africa, the first center. There is no such center anywhere in West Africa where you can do stem cell transplant to treat sickle cell anemia or bone marrow transplant for cancers and so on. So this center, we have seen it, and we are happy to say that all the staff are Nigerians. There is no foreigner here. They have been well trained, and they can undertake this process as competently, efficiently as any other center in the world. This is very good because Nigeria happens to be one of those countries with a lot of incidents of sickle cell anemia, and other cancers. We want to thank you for this new ground you have broken for our country, but we will also appeal because there are many 3 rooms to be fitted with the same procedure. It's only 24 million naira. So one room, because you have only one machine and you can treat one patient at a time, the cost now will look like, it says about 6 million. We also understand that abroad you will have to pay about 14 million in naira for you to be treated, or to have this transplant. And you add the air transport abroad, you then can see it's prohibitive. But he says if those 3 machines are put in those rooms that are already prepared for this process, then they can take about 4 patients at a time, and the cost will come down by about 50%, which is what we think, and 24 million is not too much, but people need to be sensitized to that. And I think even if you put it in your own budget, the Minister of Health can afford that 24 million in a year. Or even private corporate organizations can donate those machines to this hospital. And that's why we're talking about publicity of some of these facilities for people to know where help can come. Yesterday we were at Irua Teaching Hospital, and we saw the Lassa Treatment Center, also the first in West Africa. And the machine costs on the average only 10 million naira. He says if they have more, they can take a lot of patients. And I know we can also equip a number of our hospitals across the country with that machine to reduce the traffic of people coming all over the country. And that's the purpose of this good governance tour, to see what the best practices, how we can amplify them, and how the nation can make wise investments to ensure that we give support, at that level. So we are very happy, and you now know that 14 hospitals in the country have been equipped with the Radiotherapy machines that are treating cancers all over the country. So the Minister of Information yesterday, we said we can collaborate. The Radio Nigeria, NTA, these are public media organs. I believe we can collaborate if the medical bodies are prepared now to advertise some of these facilities, not necessarily the individuals. Some of these facilities, I believe it is possible for us to collaborate so that Nigerians will not all have to suffer to go abroad for, like the Minister of Work says, for diseases that we now have the competence to treat effectively at home. We really appreciate the huge renovation that has also taken in this hospital. You can see most of the buildings are wearing a new look in addition to these new facilities. We thank you, and please keep up the effort.
Hey,